It is 6:09 now, and it has been an exhausting couple of months as all of us continue to grapple with the effects of the coronavirus. And joining us this morning to explain a little bit about how we can check in on our mental health is Dr. Gonzalez. He is a licensed clinical psychologist. Dr. Gonzalez, thanks so much for joining us this morning.
Good morning, Alex. How are you?
I'm doing well. Let's talk a little bit about, where we are right now in this moment in time, because the stay-at-home order has been in effect for Californian residents for, we're approaching 2 months now, and a lot of us are I think, getting to the point where we're really seeing the effects of how the effects of this virus, whether or not we have it or not, has impacted our lives. A lot of people I know are, you talk about students who are missing out on graduations, missing out on their last proms, school dances, school events, the end of the year events. You also have a lot of people, like myself, we're missing baseball. We're missing the sports that we traditionally watch and, have a part of our lives for, during this time. So we're all starting to see this, and it continues day after day after day. And I know a lot of people are just exhausted mentally by all of this. What are some things that we need to be paying attention to as we continue to deal with this?
Well, Alex, you're right. It's taking a toll on everybody because every time you turn on the TV, you see these threats to not only your health and your family's health, but your finances. And it's causing a lot of stress-related hormones in the brain. A lot of fight or flight, a lot of anxiety, a lot of fear. And it wears you down. It makes you tired. And there are a lot of lost moments right now, graduation time, sports, and so forth. So I think it's really important that we check in with the people that are missing these moments and let them know that we're going to reschedule these things. We're going to have a rain check, and we need to acknowledge these lost moments. It's very important. But it's grueling, and the anxiety is high. Generalized anxiety is high all over the place. With the healthcare workers, obviously, it's a little bit higher because they're being exposed to some horrific images. So it's taking a toll on all of us in a very distinct way.
Can we kind of break this down into the different groups of people that are really, on the front lines? There are people, our healthcare workers, our essential workers, our first responders. They are on the front lines of this, going out every single day, and being out in the public and so forth, dealing with this while there is that threat that continues to loom. But then on the other end, you have people who are stuck inside, staying at home. They're working from home. They're confined to a small space. What can we do for those different groups of people to make sure that we are staying healthy mentally?
Well, that's a great question, and the stressors are different, Alex. With the people that are in the trenches and being exposed to horrific images, watching people struggle to breathe, having to coordinate care, with their loved ones if they're in the hospital, fearing for their own safety and their family's safety now, infecting family members. And the general public is a lot of anxiety as well. We do need to take care of ourselves. And the ways we take care of ourselves, I encourage everyone to have sort of a structured schedule every day and really focus on wellness. I've been telling all my patients to every day, try to have a routine of waking up. Exercising is one of the most important things we can do. And also, social distancing does not mean social isolation. To get on these platforms, check in with your loved ones, talk to people. You can go on walks, but to exercise and to also have times to have good nutrition, get plenty of sleep, talk about your feelings, make sure that you express yourself, and have peer support. Because right now we are isolated. We don't have the normal buffers we have to help us with life. Whether it's going to the movies or going to concerts or our church, our sporting events. So to really make sure that every day we exercise, we try to meditate. There's some good apps I've talked about before, Mindspace, Calm, and so forth. Check in with our people through video conferencing, get plenty of sleep, and realize that this is really temporary. This is not going to be forever. I mean, there's going to be some impact this forever, but to focus on what you can do, not what you can't do. Focus on what you have control over, not what you don't have control over. Is very important as well.
Is it possible for us to have PTSD from this?
Yeah, I mean, what we know about the research is, with the healthcare workers, you're going to probably see more of it because, again, watching people on ventilators, mechanical ventilators is life-saving, but it's nightmarish to watch that. About 10 to 20% of the people that exposed to trauma, life-threatening situations get PTSD. There is sometimes what we call vicarious PTSD just from seeing the images on TV and video. We've learned that from the military. People that are shooting drones and missiles, we're starting to get PTSD. So we can get vicarious PTSD through this. And with PTSD, you have to have symptoms for at least a month. You know, the duration of symptoms go on for a month, where you experience a lot of intense fear, you feel helpless and hopeless, and you have symptoms of hyperarousal and avoidance. Hyperarousal, where you're experiencing the trauma, the images, the nightmares, the thoughts, the feelings, panic attacks. And you have the avoidance, where you're not wanting to deal with the feelings or thoughts or even the stimuli associated with the trauma, avoiding crowds. And you see people kind of pull back. They're withdrawn from their family members, and a really decrease in functioning with their relationships, social, occupational. You see them kind of pull back. So yeah, you can get it. It's rare with the general people that aren't there. There is vicarious. It's about 10 to 20% with people that are in the trauma themselves.
All right, Dr. Corey Gonzalez, thanks so much for joining us this morning to kind of help us walk through this, because I know this is a very difficult time for all of us. And I think that regardless of where you are in life during this time, we're all experiencing this in some shape or form. So thanks so much for helping us walk through this. And we hope to have you in very soon to kind of, give us an update and kind of help us get through this. So thanks so much and take care of yourself.
Always a pleasure, Alex.